So this is chapter 35, the assessment of the nervous system. You guys will notice that we're going to actually start on page 871, and this is going to be under the recognizing cues section. Focused neuro exam components, we are going to be looking at the awake and alert patient first. And so for this patient, we are going to look at the level of consciousness, the language and speech, a cranial nerves assessment, movement and sensation, and vital signs. Next, we have our patient with altered consciousness. This patient, we are going to assess level of consciousness, cranial nerve status, motor response, and vital signs. So for our first assessment of an awake and alert patient, for our level of consciousness, this is going to be the degree of alertness or the amount of stimulation needed to arouse a patient. It can range from alert to comatose. A patient who is alert is awake, engaged, and responsive. Our patients who are lethargic are drowsy but easily awakened. Our patients who are stuporous are only arousable with vigorous or painful stimuli. And then our comatose patients are patients that are unconscious and not able to be aroused. To assess level of consciousness, begin by calling the patient's name or touching them gently. Do not use painful stimuli unless their level of consciousness decreases. Then assess awareness by asking orientation questions such as the date, the year, where they are, why are they in the hospital, and the name of their doctor or their nurse. Ask the patient to follow a few simple commands to assess memory comprehension and judgment. Loss of recent memory is an early sign of neurologic problems, especially in the older adult. For our language and speech, these can be assessed through the interview. Pay attention to the patient's ability to understand spoken and written words and communicate. If a new change or deterioration of speech is noted, you should notify the provider immediately, as it could indicate a stroke or another serious condition. And then for our cranial nerve status, these are tested to establish a baseline, and assessment procedure is going to be further discussed on later slides. On our baseline focused assessment of an awake and alert patient, one of the first things that we are going to assess is movement and sensation. An altered gait and balance can indicate a cerebellum dysfunction. Certain medical conditions can also lead to problems with gait and balance like hypertension, dysrhythmias, and heart failure, so it's important to obtain an accurate patient history. Observe for tremors such as pill rolling or hand tremors when the patient tries to do something. These can indicate multiple sclerosis or effects of psychotropic medications. To test hand strength, have the patient squeeze your hands simultaneously to compare the strength. Remember, this is not, oh, hand me your hand, and then you grab the other one separately. Make sure that they are grabbing both of your hands at the same time so you can get an accurate description here. And then there's touch discrimination. This is done by having the patient close their eyes, lightly touching them, and having them point or verbalize where they were touched. And you guys will see this again. This is something that we often do with our patients who have had a stroke. Cranial nerves. A comprehensive cranial nerve assessment is performed by a healthcare provider for a detailed neurologic assessment. Nurses typically perform baseline focused assessments. You guys can look at your cranial nerves. There is a chart for these. It is on table 35.1 on page 869. Whenever we are doing focused assessments on the cranial nerves, these are assessed to establish a baseline and test function of the cerebrum and brainstem. Several nerves can be tested at the same time. So for your eyes, your pupils should be equal in size, round, and regular shape, reactive to light and accommodation. This is Perla. The pupil being tested should constrict, which is a direct response, and the other pupil should slightly constrict, which is a consensual response. When testing for accommodation, the eyes should converge and the pupils should constrict. Pinpoint or severely dilated non-reactive pupils are late signs of neurologic deterioration. Look for asymmetry in the facial features, which could indicate Bell's palsy or a stroke. Patients with altered consciousness may be unable to participate in the neurologic assessment. However, certain tests can still be performed. The four components of a focused neuroexam on an altered patient include level of consciousness, cranial nerves, motor response, and vital signs. The Glasgow Coma Scale is used to assess level of consciousness, but it is unreliable in patients who are sedated. The patient is assigned a score for each category, and the scores range from 3 to 15. A decrease by 2 or more should be reported immediately. Remember that change in level of consciousness is the first sign of a neurologic deterioration and is considered an emergency. For our cranial nerve assessment, to assess the pupils, open the patient's eyes and observe for nystagmus. This is an involuntary eye movement, which is rapidly from side to side, up and down, or in a circle. You're also going to look for any other abnormal eye movements. The pupils should be equal and round. If they are oval shaped, it indicates damage to cranial nerve 3, which is your oculomotor nerve. Assess the reaction to light in the sides of the pupils here. The corneal reflex protects the eyes to prevent corneal abrasions. To test for this, use a small piece of cotton on the eyelid and observe for blinking. Do not make direct contact with the cornea. Assess the gag reflex by lightly touching the back of the tongue with a tongue blade. If it is intact, the palate will rise and the pharynx will constrict. Pause. Observe for the patient's movement comparing both sides. Note asymmetry or abnormal positions of the head, extremities, or trunk of the body. If a patient has no spontaneous movement, lift their arms one at a time and let them drop to the bed. Weak or paralyzed arms will fall freely compared to one with intact muscle innervation. For posturing, decorticate indicates lesions that interrupt the corticospinal pathway. So this is where we're going to have damages from strokes, multiple sclerosis, spinal cord injuries, tumors, meningitis, etc. Decelerate posturing indicates that there is a brainstem dysfunction. And for our vital signs, the brainstem regulates vital signs, and when intracranial pressure, that's ICP, is increased, it triggers the Cushing reflex. This is also known as Cushing's triad. This is going to cause hypertension with a widened pulse pressure, bradycardia, and irregular respirations, meaning vital signs are an essential part of the neurologic assessment. So this is to give you a visual of our posturing. So decortication, this is going to be figure A. In this, the patient's arms, wrists, and fingers are flexed with internal rotation and plantar flexion of the legs. In decortic posturing, we are moving our extremities to our core. This can occur with injury to the cerebral hemispheres of the brain. In decerebration, this is going to be the extension of the arms and legs, pronation of the arms, plantar flexion, and opisthotonos, okay? This is body spasm in which the body is bowed forward. And you guys can see in figure B, this patient's chest is kind of bowed out just a little bit. Their arms are turned outwards, and then their feet are flexed and pointed straight down. This is usually associated with brainstem injury. And this is our Glasgow Coma Scale again. So patients with altered consciousness may be unable to participate in the neurologic assessment. However, certain tests can still be performed here. Our Glasgow Coma Scale is used to assess level of consciousness, but is unreliable in patients who are sedated. Patient is assigned a score from each category, and you guys can see the categories here are going to be eye-opening, motor response, and a verbal response. The scores are going to range from 3 to 15. 15 is going to be the best, the most alert patient, and a decrease by 2 or more should be reported immediately. Remember that a change in the level of consciousness is the first sign of a neurologic deterioration, and it is considered an emergency. Take a moment here to look at the scenario. So we have a 56-year-old female who is brought in by EMS to the ED. The neuroexam shows that she opens her eyes to sounds, can respond to pain, and point to the location of the pain, but her speech is incomprehensible. Go ahead and take a moment to determine what her score here is going to be. You can pause your video here if you need to. The answer is her score here is going to be a 10. So she can open her eyes to sounds. According to our eye-opening chart, that is going to be a 3. She can respond to pain and point to the location of the pain. For our motor response, that is going to be a 5, localizes pain. And her speech is incomprehensible. So that is going to be a 2 on our verbal response. For our diagnostic assessments, one of the first things we are going to look at is a laboratory assessment. So lab abnormalities can result in neurologic impairment. Common labs to monitor include our BMP, serum calcium, phosphorus, magnesium, a CBC, serum albumin, and prealbumin. Vitamins, minerals, especially B vitamins, are also important to consider. Cultures are needed if the patient is having neurologic problems that result from an infection. High ammonia levels can also cause a patient to have altered mental status, especially in patients with cirrhosis. Now you'll see we have a couple of imaging assessments listed on this slide here. What I want to focus on is our nursing intervention for some of these assessments. So for MRIs, whenever you have a patient who's going for an MRI, you will always do a pre-screening questionnaire just to make sure it is safe for the patient to go into the MRI room. So determine if the patient has any implanted devices such as a pacemaker. This is going to be one of the big ones because an MRI is a very large magnet and you don't want to burn or injure the patient. For CT and PET scans, patients must be NPO after or for at least 4 hours before the scan. And for a cerebral angiography, we are going to determine allergies and pre-treat if necessary. The patient will be NPO for 4 to 6 hours prior. The head will be immobilized for the entire time. The patient must not move. Contrast will be injected into the femoral artery and it will cause a warm or a hot sensation. So make sure you prepare your patient for this. After the procedure, we are going to monitor the site for bleeding. We are going to apply an ice pack. We are going to keep the extremities straight and immobilized. We are going to maintain pressure dressing for at least 2 hours. Make sure that you are checking for adequate circulation, such as skin color, temperature, distal pulses, and capillary refill. Also check for signs of internal bleeding, such as hypotension and tachycardia. Remember, those things happen. If we are bleeding out on the inside, our heart is trying to compensate. So we're going to have a drop in blood pressure and our heart rate is going to increase. And for all diagnostics requiring contrast, assess allergies, review medical history, check that kidney function, provide hydration and kidney function after the test for 24 to 48 hours. So these are a few other diagnostic assessments, and I do want to review the nursing interventions for these as well. So for an EEG, we do not want the patient to fast beforehand because hypoglycemia can alter these results. Ensure that the patient's hair is clean and free of products. Instruct the patient to avoid sedatives for 12 to 24 hours before the EEG and ensure a quiet environment. For our lumbar puncture, this is a big one. This is one that you will see in the hospital setting. So ensure that the patient does not move during the procedure. Remember, with a lumbar puncture, we are going to be putting a needle into this patient's spine. If they are moving around while we do this, you can guess what's going to happen. They are at risk for spinal injury if we do that. So this is contraindicated with severe increased intracranial pressure in those with skin infections near the puncture site. Think about why that would be contraindicated if the patient had a skin infection near this area. We are going to be poking into their spinal column, and so if they have an infection and we are messing in a cavity that's holding cerebrospinal fluid, then that infection, that bacteria can get into that space and cause an infection in the spinal cord. We are going to monitor for signs of increased intracranial pressure. Those include a severe headache, nausea, vomiting, photophobia, and change in the level of consciousness. Monitor the puncture site for leakage and notify the provider if the headache is not relieved with prescribed medication. The patient may need a blood patch to treat the severe headache if this is the case. For our psychosocial assessment, neurologic health problems can have an influence on the patient's mental health. For example, a patient who was completely independent prior to a stroke that left them with deficits can develop depression while trying to adjust to their new normal. Depression can lead to cognitive and behavioral changes that resemble delirium or dementia. Because of this, depression is easily missed in older adults. Provide routine mental health screenings and appropriate referrals as necessary. So take a moment to read this question and review your answer choices. You can pause your video here because I'm about to click to the next slide and that is going to have the answer on it. The answer to this question is C. So asking the client about the meaning of various proverbs or fables assesses the client's abstract reasoning, which is a part of cognition. Asking the client about how he or she came to the hospital would assess memory, and counting backwards from 100 by sevens would assess the client's attention, and giving the client a simple written command would assess language and copying skills. For question number 2, go ahead and take a moment to review the question and look at your answer choices. You can pause your video here. And the answer to this is going to be A. So many things influence transmission of nerve impulses affecting the mental state. In the older adult, a lack of oxygen often causes mental status changes. Therefore, SpO2 should be assessed first. Go ahead and take a moment to read the question and review your answer choices. You can pause your video here. The answer to this is going to be A. So frontal lobe injuries may interfere with the client's ability to regulate behavior based on judgment and foresight, and also may affect reasoning, concentration, and abstraction.